Thank you for joining us for Nevada Week Extras. We're talking about Alzheimer's treatment, and we want to specifically touch in this segment on funding. It comes from many, many different sources. Camille, let's start with you. Obviously, the Lou Ruvo Center does a lot of fundraising itself.
Yes, we have to. In order to keep our doors open at the Lou Ruvo Center for Brain Health, we have to we have fundraising efforts. One of our largest fundraising effort is called the Power of Love. And that fundraiser raises millions of dollars, but for good reason. Because every year we take a $4 million plus hit to the center right here in Las Vegas. So with that $4 million hit, we need to raise those funds so we can provide the great healthcare services that we provide like no one else with the greatest of dignity. Now, one of the things that we never got to really speak of is we take great pride that our doctors have this great ability to spend as much time as they need to with our patients, whatever is necessary, and the caregivers. We also take great pride that when you come in as a patient, you're not sitting in a waiting room. So stage 1 of Alzheimer's is not looking at stage 4 of Alzheimer's, and you're not sitting there when you're still cognizant of what's going on and looking at stage 4 or stage 3 and go, is this what I'm going to turn into? Is this what's going to happen to me? So we have over 200 plus volunteers that greet our patients each and every day, take them up into an elevator with great care and dignity. I'm so proud of this. And I encourage anybody in the community who has not or would like to see what we're doing to please make arrangements to come see our building. We're so proud to share this with everybody. And we take them up into the elevator and immediately into an examining room. Nobody gets to see what the other stages look like. So in order to provide this kind of care in healthcare, and give it to these patients with dignity, we have to raise those much needed funds. And we have all sorts of fundraising events. It's not just Power of Love. You can give in so many different ways. And it all goes to the Lou Ruvo Center for Brain Health in Las Vegas.
Bravo for that process. I mean, that's something I think people wouldn't think of right off the bat, but that is vital. Wow.
And it is a lovely process. Fantastic. Everyone leaves even with a carnation, which is such a sweet touch when you're there to view it. Yeah.
And I would add to that not only is that fundraising efforts, all that philanthropy, that's not just going towards helping people get their clinical care in the moment, some types of services, but it's also helping to fund research at some level. So in Alzheimer's disease, the funding for research is actually pretty good right now. We've gone from a situation where at the national level there were only hundreds of millions of dollars, which sounds like a lot, but if you divide it up between researchers, it's not much. To more recently, we're in the billions of dollars in terms of how much funding is available. But in order to get that funding, it's often necessary for young investigators to really have some data to show that they can do something with that money that's productive. And in order to do that, it's been really helpful here in Las Vegas to have philanthropy partner with the Cleveland Clinic in order to help push forward some of that early level research to show that we can really make some changes.
And try to close some of the funding gaps, of which there are many.
Exactly.
What are the biggest challenges? What are some of the funding gaps that you, on a daily basis, hit?
I think that, so a lot of the funding from federal funding from the Older Americans Act is funding caregiver support programs. But what we're seeing is that when you're looking at funding and funding opportunities, you have to look at both sides, the caregiver and the care recipient. And what you're seeing is people really wanting to invest in legislation that is moving towards taking these services and these caregiver support programs into Medicare and Medicare Advantage plans, which would be able to have access to many more people.
Anna, you were going to say something?
I just think it's so vitally important that we keep the support services that are available through community partners free of cost to caregivers.
Absolutely.
And that's something that we really pride ourselves on, is that all our programs and services are free of charge, and that would not be possible without fundraising efforts, without legislative tasks that help fund us.
Let's talk legislation for a moment. We're going to have an election here real soon. If you could speak to all of the candidates, what would be the top of your wish list?
I would just say that Alzheimer's disease isn't a partisan issue. This is something that will
Sure.
affect you regardless of your political leanings. So to strongly consider supporting Alzheimer's disease-related legislation regardless of your colors.
Yeah, absolutely. And I think that there's some hot topics that are being discussed in our community, like caregiver support programs, and caregivers. And you mentioned it earlier that caregivers are taking off work. They're losing pay because they're caring for their family members, and really looking at how we're, as a community, supporting and allowing employers to support family caregivers in our community.
I would encourage them as well to look at some programs that are working well in other communities. Massachusetts, for example, recently passed a piece of legislation requiring all physicians and physician's assistants to have a dementia care plan in place in hospitals and to have specific dementia care training, which is not something that's currently in place.
Yeah. I do think that it's an exciting time right now, though, in our community, because we did receive some funding as a community to have the Dementia Friendly Initiative, which is a partnership with everyone at this table, and it is increasing those supports to our family caregivers and the patients.
Camille, last word.
I would strongly, this is something that's going to be hitting more and more of our Nevada citizens. And I realize that combined educational issues within our state should be correlated as well with educating our local Nevadans on how to treat these patients and how to understand what's going on, and to fund these services so that we can educate. We've even educated our Metro Police Department, because they'll see a Alzheimer's patient roaming the street and think that
Too often.
Yeah.
right. And so, funding comes from all different angles, but it's important that our legislators understand that this is coming. The tsunami is coming. You've been warned. We're reaching out. We want to hear more about it from you too. The community wants to know how you're going to reach out and help us.
Absolutely. And I think we'd also be remiss to not talk about the individuals that are living alone with this disease. And so legislation is going to impact them in a big way. What are their rights? How are they able to stay safe in their home? How do we support them in aging in place?
May I add one thing, please? I read something that was astounding. So most diseases in the last 5 years of critical diseases, such as maybe a cancer, heart disease, the last 5 years of life is somewhere around $180,000 is what is spent in taking care of that patient for their last 5 years of life. An Alzheimer's patient is somewhere closer to the $300,000, $350,000.
Yeah.
So looking at those numbers, it should be enough for a legislator to say, okay, this is going to be a burden on our society if we don't start getting creative. Get creative and think of ways, and use us as your resource. We're here for you as well as you're here for us. Listen to what we have to say. We'll try to find ways to help you, fund us, and break it down.
Well said, and I wanted to announce right now that Nevada Week is going to have a follow-up show on policy, legislation, Medicare, Medicaid, and how Alzheimer's fits into all of this, and how we can further this, as you say, Camille, and as you've all said, because it's such a devastating condition, and families can just be devastated financially, if nothing else. I mean,
and that
besides
adds
the
to the
emotional
stress.
aspect too, it's just terrible. Thank you, ladies. Thank you for
Thank
what you do.
you.
Thank you.
For joining us today.
Thank you.